My name is Andy Imholt, and I'll be moderating today's press conference. We're joined by members of the press in attendance at the annual meeting and also by journalists on the conference call. Today we welcome Dr. James Sejvar with the Centers for Disease Control and Prevention in Atlanta. Dr. Sejvar is a neuroepidemiologist with the National Center for Emerging and Zoonotic Infectious Diseases. Dr. Sejvar will be providing an update on the emerging Zika virus and the brain. Please reserve your questions until the end of Dr. Sejvar's briefing. We'll take questions first by those in attendance in Vancouver and then from those on the phone. Please remember to identify yourself and media outlet prior to asking your question. Just a reminder, there is no embargo on the information being shared in this presentation. Immediately following this press briefing, Dr. Sejvar will be presenting the session Zika virus, Neurologic Complications of the Latest Emerging Pathogen at the Hot Topics plenary session located in Room West Exhibition Hall A. At the session, he will be discussing the recently identified neurologic complications with the Zika virus infection. Welcome, Dr. Sejvar.
Great, thank you very much. So, Zika virus has been around since 1947, but until recently, we saw it in isolated cases or small clusters in Africa and parts of Asia. Most people who got Zika had no symptoms, and those that did had a mild rash illness. Then, in 2013, health officials in French Polynesia reported a concerning increase in Guillain-Barré syndrome cases that coincided with a large outbreak of Zika, the largest outbreak of Zika to that point. Since that time, at least 12 countries in Central and South America and the Caribbean have reported increases in Guillain-Barré syndrome following the introduction of Zika into their countries. This is the strongest evidence to date that Zika and GBS are linked. As the outbreak continues, we are learning more, and we hope to be able to better understand the relationship between these two conditions. It's critical that research continues. CDC and local health partners in the affected countries are doing a number of investigations now to help us learn more about whether Zika can trigger Guillain-Barré syndrome and other neurologic symptoms. Along with the Brazilian Ministry of Health, CDC conducted a case control investigation in northeastern Brazil, one of the hardest hit areas affected by Zika, in January 2016. And our preliminary analyses are already revealing some troubling trends. First of all, nearly 90% of the GBS patients reported a Zika-like illness prior to their GBS illness. It also appears that cases of GBS in Brazil are nearly 5 times the number that we'd expect. About half of GBS patients in our study were still experiencing moderate to severe symptoms 6 months after they initially became ill. Our labs are testing blood and urine samples collected in Brazil, and we're hoping to determine whether GBS cases had a recent Zika infection and how that compares to Zika infections in controls who did not get GBS. We hope that this will tell us more about whether Zika triggers Guillain-Barré syndrome. We're also embarking on a similar study now in the country of Colombia, which is the second most heavily affected country in the current outbreak and is also reporting large numbers of Guillain-Barré syndrome cases. We've also begun some important work in Puerto Rico. We'll be conducting Guillain-Barré syndrome surveillance in Puerto Rico in advance of what we anticipate may be a large Zika outbreak on the island this spring and summer. By setting up surveillance ahead of the anticipated Zika outbreak, we hope to gain more information about the development and progression of Guillain-Barré syndrome in real time. And lastly, as many of you may have heard this week, some of my colleagues at CDC who specialize in birth defects have just published a paper that recently concluded that Zika virus infection during pregnancy is a cause of microcephaly and other severe brain abnormalities in newborns. And this is a finding that is likely to have substantial societal and public health implications on nations affected by the ongoing Zika epidemic. Now, to date, There have not been any cases of Zika virus spread from mosquitoes in the continental United States, but more than 300 people have become infected while traveling to Zika-affected countries. So clinicians in the United States should be aware of the potential for Guillain-Barré syndrome cases as travelers return from Zika-affected countries. Early intervention in Guillain-Barré syndrome through the use of intravenous immunoglobulin or IVIG and or plasma exchange or plasmapheresis halts the progression of GBS. Rapid treatment leads to less degree disease progression, better outcomes, and less morbidity and mortality in GBS cases. Guidance for women who are pregnant or plan on becoming pregnant are available to reduce the risk of now apparent Zika-associated birth defects and other adverse pregnancy outcomes. Recommendations on limiting the risk of sexual transmission of Zika virus, another troubling development in this ever-confounding pathogen, are also available. I'd like to close by saying that as a neurologist, I have never seen anything like what we are seeing in the ongoing outbreak in Central and South America. CDC and other public health officials in the United States will continue to work tirelessly to learn about Zika virus and its potential complications. We will remain vigilant for the possible emergence of a locally transmitted Zika virus infection. As always, in our mission to protect the public's health, we will disseminate new information on the emerging features of this virus as soon as they become available, and to continue to be vigilant for other emerging features of this pathogen to protect the health of the people in the United States and globally. And I will thank you for your attention. Thank you.
Thank you.